Ma'am.
Thank you. Hello and good afternoon. Thank you for joining us for today's press briefing. I'm Supervisor Catherine Barger, Chair of the Los Angeles County Board of Supervisors. Dr. Barbara Ferrer, Director of the Department of Public Health, will provide an update on COVID-19 case counts and recent trends in Los Angeles County. As the county faces the challenges created by the coronavirus pandemic, our first responders and emergency management team continue to battle the Bobcat fire. Over the last several days, as winds picked up and shifted, the blaze has moved away from the San Gabriel Valley region and spread toward our Antelope Valley communities. The Red Cross is working with emergency personnel and local leaders to provide resources and support, including food, water, and a safe place to stay for families and pets. And throughout the entire county, as many people remain out of work or are working less, we continue to see a need for supportive services and assistance. Our food distribution and partnership between the county and the Los Angeles County Regional Food Bank is now expanding to 3 events per week. To date, we have hosted 33 events and provided more than 2,000 tons of food to approximately 60,000 households. During these drive-through distributions, residents are provided with boxes of groceries that include shelf-stable items, dairy products, frozen meat, and fresh produce. To find an upcoming food distribution event or to learn how you can become a volunteer or donate, please visit covid19.lacounty.gov/food. Again, covid19.lacounty.gov/food. In addition, the state has extended the Great Plates program, which provides older adults with 3 free restaurant-prepared meals. Through Friday. Approximately 100 grants of $75,000 will be awarded to qualifying nonprofits. To apply, visit lacovidfund.org. Finally, as we seek to serve those in need, youth must be our priority. With school back in session, we see the digital divide among children trying to learn at home. In response, last week, the Board of Supervisors allocated nearly $13 million in federal coronavirus relief funding to the Los Angeles County Office of Education to purchase much-needed computers and Wi-Fi hotspots. Our goal is to get students back into the classroom following public health protocols. The computer and Wi-Fi hotspot resources will be distributed to students through local high school districts to assist with new learning guidelines. This will ensure that students have the tools they need to thrive this school year while we wait for their return to the classroom. With that, I would like to invite Dr. Barbara Ferrer up to give you today's outlook. Thank you.
Thank you, Supervisor Barger, and to the entire Board of Supervisors. Your extraordinary leadership and tireless work addressing the needs of LA County residents during this very difficult time has made a huge difference. And good afternoon, everyone. Thank you for joining us. Today, I'm going to present some short updates on the impact of COVID-19 amongst workers and at work sites across LA County. From healthcare workers to employees at other work sites, the health and safety of workers is of utmost importance. At all of our workplaces, we're often with colleagues and sometimes with customers whose exposures to COVID-19 are unknown. Because of this, there's a significant potential for transmission of the virus at workplaces, making it critically important for employers to adhere to the workplace protocols that require infection control, distancing, masking, and supplying workers with appropriate personal protection equipment. This is particularly important since after work, many of us go home to family members and other people that we live with, some of whom may be at very high risk for becoming seriously ill from COVID-19. I'm going to show this first slide. This graph shows cases by week among healthcare workers. Throughout the pandemic, we've been very concerned around the health and safety of our healthcare workers. And we have almost 15,000 healthcare workers to date that have tested positive for COVID-19. As you can see, in March, before it was understood that people without symptoms and were positive for COVID-19 could transmit the virus, and at a time where we had a nationwide shortage of personal protective equipment, we saw a spike in cases among healthcare workers, and it peaked at 652 cases in early April, as you could see that first peak there. As the virus was better understood and as PPE became more available, cases among our healthcare workers started to decrease. However, when in LA County across the board we saw our increases in July, for healthcare workers, we also saw a spike in our cases at 699 cases. Cases among healthcare workers, fortunately, have continued to decrease since that spike in July, and this reflects a similar decrease that we've seen in cases all across the county. Note that at the end of this graph, we have a 2-week reporting lag here, and so we'll have to continue to see and continue to hope that the work we're doing shows the continued decrease in cases amongst all of our healthcare workers. And the next slide, please. This slide shows that the vast majority of healthcare workers who tested positive for COVID-19, about 68%, are women, 30% are men, and 2% identified with another gender or the gender of the individual. The healthcare worker was not specified. This in part reflects the composition of the healthcare workforce. We know that women account for about 3/4 of full-time healthcare workers. And among healthcare workers who tested positive for COVID-19, you can see that 46% were between the ages of 30 and 49, 26% were between the ages of 18 and 29, 23% between the ages of 50 and 64, and about 4% were between the ages of 65 and 79. And again, this is going to mirror the composition of the workforce. The next slide. Among healthcare workers who tested positive for COVID-19, almost half are Latino, Latina, Latinx. 15% are Asian, 11% are white, and 7% are black. Slightly over 1% of healthcare workers who tested positive for COVID-19 are Native Hawaiian and Pacific Islanders, and slightly over 1% identified with 2 or more races. 2.5% identified with another race, and 13% race and ethnicity data was unknown or unspecified. The next slide, please. I'm really sad to report that to date, 89 healthcare workers have passed away from COVID-19. And the majority of the deaths, as you can see here, happened early in the pandemic, with spikes in both late April and then again in mid-May. Since then, we've seen a steady decrease among healthcare workers, and we're hoping that our continued efforts to ensure safety for healthcare workers continues to result in reduced exposures and, of course, reduced cases. I do want to take this moment to thank all of the healthcare workers across LA County. You're truly among the heroes of this pandemic. You've been at the front lines courageously battling and treating patients from the very beginning of the pandemic, even when there was so little that we knew about this virus. We deeply appreciate your commitment, and we thank you for caring for everyone that needs your help. And to all who are mourning the loss of a healthcare worker who passed away from COVID-19, we mourn these heroes with you. Our compliance efforts and outbreak investigations also focus on protecting workers in other work sites and across other sectors. The next slide provides an update on our outbreak investigations. And this graph shows non-healthcare and non-residential workplace outbreaks by the week And we've also added in different closings and reopenings of sectors on the same timeline. The white line represents general work sites. That's all work sites that aren't otherwise broken out on the graph. And the blue line represents food facilities. And as you can see, these are the two workplaces where we've had the most outbreaks. And outbreaks at general work sites and at food facilities significantly increased once we reopened our workplaces. And you can see that clearly here. And once some sectors closed again, the number of worksite outbreaks absolutely diminished significantly over time. This graph also captures, and I'll take the next graph, sorry. This graph captures the case numbers at non-healthcare and non-residential workplaces where there's a documented outbreak by work site. So still working with those work sites that we know have an outbreak, but now we're looking at cases, not just outbreaks. And similar to the previous outbreak graph, we saw sharp increases in the number of COVID-19 cases at the general work sites, that's the white line, and at food facilities in the blue line, subsequent to the reopenings. Cases at both of these types of work sites peaked in mid-July with about 256 weekly cases at the general work sites and about 213 weekly cases at food facilities. And as you'll note, again, similar to outbreaks, the number of cases at work sites has decreased with the subsequent closures that have happened. Next slide. Our compliance team is out visiting businesses across the county every single day. And our inspectors review our county reopening protocols with business owners, operators, and employees to make sure that they're familiar with all of the requirements related to disinfection, the use of face coverings, physical distancing, and any other required modifications, including the provision of personal protection equipment. Initial efforts are always focused on educating business owners and workers about how to stay safe. But our protocols are not just guidelines. They are directives, and they require compliance by every business. So in addition to education, we are also prepared to enforce the health officer order using fees and fines, and when necessary, closure of businesses that are in violation of the health officer order or our protocols. As a result of inspections conducted since August 30th, 46 citations have been issued to 25 different establishments. In some cases, these establishments were also closed because there were significant health and safety concerns or flagrant violations of the health officer order, including operating indoors in violation of both the state and the county health officer order. Next slide, please. And a couple of weeks ago, with support from the Board of Supervisors, we were able to launch the COVID-19 Safety Compliance Certificate Program. This is a voluntary program that allows businesses to complete an online training and self-certify that they're fully implementing the required COVID-19 protocols to make sure that their workplace is as safe as possible for both employees and customers. The training can be completed online by both business owners and managers as well as employees. And we're really happy to see that so many have already taken advantage of this training opportunity. To date, 663 employers have taken the training, and they receive a certificate that they're able to post at the work site. And 712 employees have also taken the training. And I want to thank everyone who's taken advantage of this new program. If you'd like to participate in the training, it's free, and you can link to the training from the DPH website's main COVID-19 page. And now I just want to quickly move and update us on our current status. And as a reminder, today's Monday, so our death and case counts will reflect the weekend lag in reporting. But we are sad to report an additional 16 deaths today. 8 of the people who died are over the age of 80, and all of the people who passed away in this age group had underlying health conditions. 4 of the people who died are between the ages of 65 and 79, and 2 people who passed away in this age group had underlying health conditions. 2 people who passed away are between the ages of 50 and 64, and none of the people in this age group had underlying health conditions. And 2 people who died were between the ages of 30 and 49, and 1 person had underlying health conditions. This does bring the total number of deaths in LA County to 6,366. Every day, these numbers are a staggering reminder of the many people across the county who have lost loved ones or friends to COVID-19. We wish all of you healing and peace at this very difficult time. 92% of the people who have died from COVID-19 had underlying health conditions. As a reminder, while many people are out and about, those of you with underlying health conditions need to stay home as much as possible. For the 5,989 people who passed away, where race and ethnicity has been identified, 51% are Latino, Latina, Latinx, 23% are white, 15% are Asian, 10% are Black, slightly less than 1% are Native Hawaiian or Pacific Islander, and 1% identified with another race or ethnicity. We are reporting 652 new cases today, which brings the total count of total cases in LA County to 261,446. These cases include a total of 11,503 cases reported by our partners in the city of Long Beach and 2,522 cases reported by the city of Pasadena. 749 people are currently hospitalized with a diagnosis of COVID-19, and 28% of the people are confirmed cases in the ICU, and 16% are on ventilators. We've investigated to date a total of 1,797 residential congregate settings and non-residential settings with at least 1 confirmed case of COVID-19. Currently, we have 460 ongoing investigations, and we've closed 1,337 investigations. The total number of confirmed cases in institutional settings is 34,289. 17,348 of the confirmed cases are among residents, and 16,941 are among staff. I am sad to report that 2,784 residents in institutional settings have died from COVID-19 since the beginning of the pandemic, with 2,504 people residing in skilled nursing facilities, making up the large portion of those in institutional settings that passed away. And to all who are grieving, again, we're so sorry for your loss. I want to report that over 2.5 million people in LA County have been tested and had their results reported to LA County, and our cumulative rate has dropped now to 9%. This is a slight decrease, which reflects the fact that our daily positivity rate has been steadily declining for the last 6 weeks. And in closing, worker protections and safe workplaces are an essential part of our strategy for slowing the spread of COVID-19 and protecting the health of our communities. And I want to thank all of the many, many thousands of workplaces that are following all of the requirements for opening their workplaces in a manner that's safe, protects the workers and the customers. I also want to let folks know across the board for all businesses and institutions how the Department of Public Health can support your work site. We have, for starters, a lot of different ways that people can report to us if they have concerns about a work site or they think there are violations of the health officer order. And it's important that people can report violations and concerns anonymously. You can do this through our Environmental Health Customer Call Center, Monday through Friday between 8 and 5 p.m. And the number is 1-888-700-9995. There's also an online complaint system to report violations 24/7, and that's available when you go to our website, publichealth.lacounty.gov. Public Health also provides workplaces with recommendations and instructions regarding safety measure improvements that you can use to control and prevent COVID-19 outbreaks. We have posters and other educational materials regarding both best hygiene practices and reminders to wear face coverings. Businesses are free to download those materials and use them anywhere that they think is appropriate. We'll assist you with outbreak management if you have 3 or more cases at your work site. And this is to ensure that all identified cases and close contacts have been appropriately isolated or quarantined. This is our way of helping you reduce transmission at workplaces. We monitor these ongoing outbreaks and provide further corrective action instructions until the outbreak is over, and there have been no additional new cases over a 2-week period. We're also available to provide information on workers' rights, and as many of you know, we're working closely with the Board of Supervisors to establish worker public health councils that can help ensure employee safety, particularly among sectors that have experienced a high number of outbreaks and/or high numbers of cases. And now we'll take your questions.
Ladies and gentlemen, if you'd like to ask a question, please press 1 and then 0 on your touch-tone keypad, and an operator will gather your name and your media outlet and further assist you. You may withdraw your question at any time by repeating the same command. If you're using a speakerphone, we ask that you please pick up the handset before pressing the numbers. Once again, if you have a question, please press 1 followed by 0 at this time. And first, we'll go to the line of Patrick Healy. Your line is open.
Hey, Patrick.
Hi, thank you very much. Doctor, if I could ask a couple of questions. First, a simple math question, where we need to get our daily case rate down to be able to move into the red tier. 7 cases a day, new cases a day on average per 100,000, 10 million people in the county. That tells me about 700 new cases a day. So first of all, is my math correct? And second, are we concerned that over the past week, the number of cases, apart from today, and you already explained why, has stayed stubbornly at or over 1,000? And one final question on the distinction between aerosol spread and droplet spread, and CDC dropping its new guidelines about aerosols. If indeed aerosols are a significant spread, does that really undercut the value of wearing masks? Because masks are not nearly as effective in keeping out the aerosols. I know that's a lot, but thank you for taking a stab.
Thanks so much, Patrick, and appreciate both questions. Let me start with the easier question, which is what does it take for us to get Tier 2, and is your math correct? So to get to Tier 2, you're right, Patrick, we do have to see that our daily case rate, that's the number of cases per 100,000 people in the county, has to be at or below 7 cases per 100,000 people per day, and it is an average. And we'd have to see that over 2 consecutive weeks before we would be eligible to move into Tier 2 or the red tier. And you're right, we saw some lower numbers back in the earlier part of September, but those lower numbers really reflected some days where we had a high heat event and then where we had poor air quality. And the last 4 days minus the weekend numbers did see us with a count that was always over 1,000 new cases per day, which would make it hard for us to get into Tier 2 at this point in time. I want to note that the state does apply an adjustment to your case numbers to reflect how much testing you're doing. So we do a lot of testing. So even if we were seeing, 800, 900 cases a day, which seems like it would be over the threshold, with the adjustment that really accounts for those counties like ours that do a high volume of testing, that case could drop to 7 or less. We will get the new numbers tomorrow, but I agree with you. We've had a troubling trend the last few days of last week, and we think, in fact, that could allow us to not be able to make movement into Tier 2 in the upcoming couple of weeks. The question about CDC, it's a good question. As you know, CDC posted, I think either late Friday or early Saturday, some guidance that indicated that while respiratory droplets are still the main way this infection gets transmitted from one person to the other, and that's why these face coverings are absolutely essential, there is the possibility that there also can be spread through aerosolized droplets, which again means that those indoor sites, particularly those indoor sites where people aren't wearing face coverings and are in close contact with others, could in fact be problematic because of the fact that there's a possibility of aerosolized transmission. I want to note that both in this county and across the state, one of the reasons why we've been asking people to do as many activities outside as possible is because we've known for a while that there are studies that have come out that have indicated the possibility of aerosolized spread. And again, I think CDC pulled it back because they're looking to make sure that they have definitive answers and studies that have lots of evidence that this is happening. We do know there have been some studies, you've seen them as well as us, which is why right now we're sort of in this space where we're asking people to be super cautious, do as many activities outside as you can, but please, whether there's aerosolized spread or not, there is definitely respiratory droplet spread, in which case it's super important for people to continue distancing and to continue wearing their face coverings. So thanks for that. We'll take the next question.
And next, we'll open the line of David Rosenfeld with LA Daily News. Your line is open.
Hi, thanks so much. I was wondering if you could provide a brief assessment of where you see the county being there. It is about 2 weeks after Labor Day. We're all waiting patiently to see if there will be any type of surge. I wonder if there's any data points that lead you to believe one way or the other at this point. And also, in terms of the violators that you mentioned earlier, will the department provide a list of who those, what those businesses are, and were any of them like super egregious, like a bar, for instance, having a lot of people inside, or something like that? I wonder. Thanks.
Thanks so much. And as I noted, we are looking every day at the data to see whether we have an indication that we are going to see a surge in the number of cases, which would be the first place we would see an increase related to how we all behaved with each other over the Labor Day holiday. And as I just noted, we do have 4 days of data from last week that showed a significant increase in the number of cases. We'll need to look at Tuesday, Wednesday, Thursday, and Friday's case data here to see whether that increase continues or we actually stabilized. I think at the end of this week we'll have a much better sense in terms of case numbers about whether or not we see what we think would be indicating more transmission. And as you know, if you look at our data, we saw that 2 to 3 weeks after Memorial Day, and we saw that again, really our biggest surge, 2 to 3 weeks after July. After you see the increase in cases, that's when, another week or two later, you start seeing an increase in hospitalizations, and then that often is followed by, unfortunately, an increase in deaths. So I want to be cautiously optimistic, but we did have 4 days of data last week that showed increases in cases, so we're going to have to pay a lot of attention to the data this week. And in terms of do we list the businesses that have been closed or that we've issued citations to, I'll have to go back and check. I mean, we list all of the businesses where we have outbreaks, but I'm not sure that we've yet posted businesses where we've issued citations and or businesses or institutions that have been closed. But let me check with my team, and we'll get back to you on that one. And now I know we're going to go to remarks in Spanish from Jackie Valenzuela.
Buenas tardes. Hoy tenemos algunas actualizaciones sobre el impacto de COVID-19 entre los trabajadores y en sitios de trabajo a través del condado de Los Ángeles. En todos los sitios de trabajo estamos cerca de colegas y a veces de clientes cuya exposición a COVID-19 se desconoce. Existe un potencial significativo de transmisión del virus en los lugares de trabajo, por lo que es tan importante que los empleadores adhieran a los protocolos del lugar de trabajo que requieren control de infecciones, distanciamiento físico, el uso de equipo de protección personal apropiado para todos los trabajadores. Esto es particularmente importante ya que después del trabajo muchos de nosotros regresamos a las personas en nuestros hogares. Algunos quienes pueden tener una condición delicada